Women are said to be at higher risk of developing gallstones.
It's not very good to actually generalize to say that this is a women's disease, because it actually affects a good group of the population, which include males.
Are gallstones common, and how do we get them?
Gallstones are actually quite common, and 20% of our human population has gallstones. Okay, and gallstones usually arise from abnormality of three things.
Find out the symptoms of having gallstones.
Usually this pain is worse after taking food, especially heavy meals or fatty food. Some people will say they can't take their nasi lemak anymore.
Why is it dangerous to self-medicate?
I think what is dangerous is that a lot of patients go around thinking that they are well after that, because they have no more symptoms.
Detecting gall diseases early could save your life.
In my field, it's actually quite morbid, because 80% of the patients who come to me are no longer operable.
In this episode, Kevin Francis speaks to Dr. Koong Jun Kit, Consultant General and Hepatopancreatobiliary Surgeon, University of Malaya Medical Center. You will learn about gallstones, its symptoms, treatment and surgery. If you're ready, it's time to man up with Dr. Koong Jun Kit.
Okay.
Thank you for being on the show.
Thank you for having me.
I think our topic today is something that's very much in your expertise as a HPB surgeon. And I mentioned HPB because I think if I mention what it stands for, I will just mess it up.
It's a mouthful. I think even doctors can't pronounce it properly. Yeah.
Let's hear you pronounce it.
Hepatopancreatobiliary. The Americans call it hepatopancreaticobiliary. It's always different,
So actually, what does it mean, Dr. Koong?
Well, hepato means liver, pancreato means pancreas, and biliary means just the bile ducts and the gallbladder and so forth. So all these organs are in a specific part of your body, and we are basically the surgeons who focuses on the diseases on those parts of the body. That's what we do.
One of the reasons why I picked this topic is because they often mention that it's more common in ladies, this disease relating to the gallbladder and gallstones. You would say a lot of men also get affected by this, right?
Yeah. Well, traditionally, people will call this disease a fair female and forte disease, which is a typical population which would get this kind of problem. But having said that, we do have a lot of patients with gallstones and its gallstones complications who are male as well. So, I think it's not very good to actually generalize to say that this is a women's disease, because it actually affects a good group of the population, which include males.
And it's not just older men, right?
Yeah, I mean, we're seeing patients who are younger and younger to have this kind of problems, 40 to 50 years old as well. And sometimes even gallstones, when they cause problems and complications, a lot of patients, a lot of men do not notice it, actually.
Okay, we'll go through the causes in just a bit. But first, Dr. Koong, it seems like even if the gallbladder is removed, which is common, you can live a normal, healthy life without any diet restrictions. So why do we have a gallbladder, and what is it for?
Well, a gallbladder is actually it's a functional organ in our body, actually. So what it does is it's actually a sac that keeps our bile. Basically, our liver produces bile. And as the liver produces bile, it flows down into the bile duct and is kept into the gallbladder. And as soon as we eat, as food passes past our stomach into a portion of the small bowel called duodenum, the gallbladder will then squeeze a little bit of bile to help digest fat. And that is a function of bile, to help digest fat in order to absorb fat. After surgery, after removal of gallbladder, interestingly, the bile duct then replaces the function of the gallbladder, because they all anatomically arise from the same structure when we were born. So it is actually quite safe to have the gallbladder removed without having any long-term complications.
Where do we get the bile from if we remove the gallbladder?
The bile is produced in the liver, Kevin. It is only stored in the gallbladder.
I see.
So basically, it's a storage space. And in the gallbladder, sometimes it also concentrates the bile. But like I said, this process can be taken over by the bile duct. There's no problem. The liver produces about 500 mils of bile every day, depending on whether you're fasting or you're taking food. And basically, the bile is just being stored in your bile ducts. That's all.
All right. So gall diseases usually begin with gallstones. How do we get gallstones?
Gallstones, first of all, I'd like to state that gallstones are actually quite common. And 20% of our human population has gallstones. Okay? And gallstones usually arise from abnormality of three things. So your bile is actually made out of bile salt, cholesterol, and is usually being concentrated in your gallbladder. So when there's an abnormality in your bile salt, in your bile fluid, and the cholesterol, and as well as the gallbladder, then stones can actually form. So we're talking an imbalance of these three things.
And what causes these abnormalities?
Well, multiple reasons, Kevin. Sometimes these reasons could be due to postulated, for example, especially in females, things like estrogen. Some patients who take HRT can actually have an increased risk as well. Some patients who have high cholesterol, they may also develop cholesterol stones, which is fairly common in the gallbladder. And sometimes just abnormality in the gallbladder itself could produce gallstones. A low motility in the gallbladder as well. In rare situations, infections, which is actually quite uncommon in the urban population, can also cause gallstones. The other rarer causes of gallstones would be things like patients, especially young people, who have blood disorders. So when they have blood disorders, so therefore they have an increased amount of blood byproducts, which is produced. And this is changed into a form of stones. Once the bile comes out from the liver and is being stored into the gallbladder. A good case in point would be patients, for example, with some of the patients with thalassemia, some of the patients with other blood disorders, which is not as serious. They can produce gallstones as well.
And the size of these gallstones, they do increase, if you don't take care of it, right?
Yeah, I think as many things in men's health, size doesn't matter. So yeah, I think the size of the gallstones can increase, and the number also can increase. Usually the size doesn't matter until it causes a person's symptoms, signs, and also complications. However, gallstones, which is more than 2.5 centimeter, and previously in older literature says it's 3 centimeters, associated with higher risk of gallbladder cancer. But otherwise, the complications and the size doesn't really have a lot of correlation. Yeah, the different types of stones. So usually when we talk about gallstones, there are 3 types of stones. There's basically 2 types. You have pigmented and non-pigmented stones. So non-pigmented, usually they're yellow in color and they're called cholesterol stones. And usually a pigmented one will be black and brown stones. So black stone is usually associated with things like your blood problems, like I told you about just now. And this kind of blood, when they break down, they form these coagulants of black stones in the gallbladder. Brown stones is associated more for infection. So patients with repeated infection in the biliary tract, in the gut, can get brown stones. But most of the time, what we see commonly nowadays are mixed picture. Patients who actually have cholesterol stones, which may actually get infected and turn brown and so forth.
So it's not necessary to remove the gallstones, right?
No. 20% of people actually can have gallstones, like I mentioned just now. So out of 10 people, 2 of them will have gallstones. And out of this 20%, only 20% will get complications. So these are the 20% which will need to have their gallbladder removed. We don't just remove the gallstones, we have to remove the whole gallbladder. Because the gallbladder is basically the gallstone factory, we call them. So we always advise patients to remove the gallbladder, not just the gallstone. Otherwise, it can recur again. Therefore, a gallstone to form, the gallbladder is already dysfunctional. Actually, we cut open the gallbladder, we give the patients back the stone, and we send the gallbladder to the lab to test it out. You can keep the gallstones as a souvenir.
Can you put the gallbladder back in after that?
No. You can't. I think we get sued if you do that. Usually, no, we can't put the gallbladder back in.
Okay, but I've heard of dissolving the gallstones. That's possible?
In a very specific and a very small population. So there is a type of medication which patients can be given, and usually we give it for patients who are, for example, the infirm, people who are, for example, too sick or too ill to have surgery done. And for example, institutionalized patients who are paraplegic, doesn't have a lot of quality of life. But these medications can only resolve 50% of the stones in 50% of the time. And most of the time, it takes 2 years for the medications to go on. And it doesn't really work very well. And they only work on certain type of soft stones. It doesn't work on all stones. So hard stones usually it doesn't work. So generally, there are no effective medication in order to treat gallstones.
We watch a video on YouTube which supposedly tells us how to dissolve the gallstones. I mean, is that something we should be wary about?
Yeah. I think I have a lot of patients who actually will try these treatment and these medications. The most common one is drinking apple juice, and some will say take vinegar together. And some will also tell me they will pass out, they see small little stones coming out in their stools. But what we don't know is the type of chemical reaction and also the coagulant that can form that doesn't get digested when you take these both things together. Yes, they are safe to try, and they are all natural. But I think what is dangerous is that a lot of patients go around thinking that they are well after that, because they have no more symptoms until the next episode of problem comes. Because after that, it's very difficult to see. Once gallstone complications and problems come, the next time that it happens, like I said, it may lead to quite disastrous problems, prolonged hospitalization, and sometimes it affect other organs and affect other parts of the body. So you don't want to let that happen. Yeah, I think that's one of those things in which you shouldn't gamble with. So basically what we do for surgery is that we do a keyhole surgery. It's called laparoscopic surgery. There's a small hole in the belly button. Some surgeons does 3 holes, some surgeons does 4 holes. And using a camera, they use another 2 or 3 instruments inside and then remove the gallbladder. And this gallbladder is then taken out through the belly button. Before the laparoscopic surgery was done, we used to have this big cut, underneath the rib, so they can visualize the gallbladder. But laparoscopic or keyhole surgery has now become a standard practice and a golden, is a key procedure and a procedure of choice to treat gallstones.
And obviously, recovery is faster than...
Oh, yeah, recovery is faster. The first thing that patients ask me is, when can I start driving? So usually I'll tell them, you can start driving as soon as you can step on your brakes without feeling pain, and as soon as you can wear a seatbelt. And most of my patients are usually back to work within the second week. In fact, we do these things called daycare laparoscopic surgery, whereby the patients admit in the morning. We do the surgery, which usually takes about an hour or 2, and then we'll observe them. They have to get up, go to the toilet on their own, eat and drink, and if they're okay in the evening, they can go home. It's called a daycare surgery. Yeah. So it's quite straightforward actually.
Apart from driving, there are other activities that they probably can't do for a couple of weeks.
I think most of them are usually concerned with how, when they have a wound there, a lot of people are worried that the wound might burst out and burst open.
Yeah.
Well, usually that's not the case. So the most painful area that you'll get with keyhole surgery is just underneath your belly button. A lot of patients can complain to me. I had that scar before. I had appendectomy done before via keyhole surgery, and it was through my belly button as well. You basically will just feel it feels very tight around the area, and you can get some inflammation in the area, but you can soon go back to what you do normally. So for my older patients, they are more concerned with things like walking, basically whether they can exercise, because some of those patients who are actually working, and especially in the urban population, is whether they can drive to work. For example, patients who are Grab car drivers and so forth, with food on the table, and people who basically do a lot of manual work, things like carrying and so forth. They will want to know whether they're able to carry heavy things. And I usually advise them to take off those heavy lifting maybe for about a month until all the pain resolves. But most of them are usually back to normal activity after 2 weeks.
Is there any side effects after you remove the gallbladder?
Well, some patients do get this post-cholecystectomy syndrome, and some patients do get a bit of diarrhea. They get a bit of diarrhea after removing the gallbladder, especially when they take fatty food. They'll rush to the toilet after they take a fatty food. Most of the time the body will adjust itself within 2 to 3 months. But otherwise, taking out the gallbladder is actually quite safe. Some patients after taking out the gallbladder may get repeated infections in the bile duct. That problem occurs quite rarely, and it requires more surgical intervention after that. I do not see that many of it happening in my patients, to be honest. And in my center that I practice, we do actually quite a lot of gallbladders a year.
And apart from removing gallstones, are there any other reasons that may cause the need to remove the gallbladder?
Yeah, I think one of the most common cause, if there's no gallstones, is usually what we call gallbladder polyps. So polyps are little growth in the gallbladder, within the gallbladder wall. Now, these polyps are usually what we call cholesterol polyps. Okay, they could be formed due to reaction of the wall of the gallbladder towards cholesterol crystals, and then the cholesterol crystal can actually coagulate and form a stone that looks like a polyp. And how we know something is a polyp and something is a stone is that some of these patients, some of you guys will know if you've done an ultrasound, if they were to rub this ultrasound. So ultrasound probe is those things that they use when we look at those babies, we put on the mother, and usually they put the probe over the gallbladder, and if they see something, then they ask you to turn. If it drops, then you know it's a stone because it moves.
Oh, okay.
And if it doesn't drop, then they say, oh, this is a polyp. Now, usually a polyp is a growth. And the thing is, we do not know what growth is it. Is it something bad? Is it something good? There are some indications that this growth could be cancerous. For example, size. If the size is more than 1 centimeter, it's been associated with a risk of gallbladder cancer. Anything between 6 millimeters to 1 centimeter, there is a small risk of it happening. And anything less, about 4 millimeters, there's absolutely no chance of it becoming cancerous. So most of the time when our patients get polyps, we usually just observe. If it's less than 6 millimeters, if it's between 6 to 1, I say, look, it's up to you, but we need to watch this closely every 3 to 6 months, But if it's more than 1 centimeter, I say I'll take it out. It's quite safe to take it out because once a person is actually diagnosed with gallbladder cancer, most gallbladder cancer are silent, and in my field, it's actually quite morbid because 80% of the patients who come to me are no longer operable, and operation or surgery is the only cure for cancers in liver, pancreas, and gallbladder disease. So that's why it's actually quite morbid. So when we see something like a polyp in the gallbladder, we want to follow them up closely, and if it's suspicious or dangerous, we'll remove it because the treatment is fairly low risk as compared to the risk of the disease that the patient can have.
So now, Dr. Koong, what are the signs or symptoms that we may have gallstones?
I'll go to the most basic one. The symptoms. Symptoms basically is described by what a patient describes, what a patient may feel, and signs is basically what are the type of findings that a physician can find the patient have. So we go through symptoms first. Some of the symptoms will include pain. Pain usually in the upper abdomen, okay, just below your rib cage. Sometimes it can be in the center. Sometimes it could be on the right side. And usually this pain is worse after taking food, okay? Especially heavy meals or fatty food. Some people say after going for kenduri, then they have increased amount of pain. After you go for wedding dinner, then they encounter pain. Some people will say they can't take their nasi lemak anymore. Some of this pain is also associated with a bit of the back pain. They complain of shooting back pain to the back. So those are some of the symptoms. Now, that is if the stone blocks the bile duct, and every time the gallbladder tries to squeeze, the stone doesn't come out, it causes pain. All right. So you can imagine as you eat, the gallbladder tries to squeeze the bile, but instead of bile coming out, the stone gets blocked in what we call the cystic duct, the opening from the gallbladder into the common bile duct. It gets blocked. Okay. And as soon as you finish eating, the gallbladder stops contracting, the stones fall back, then you don't have any more pain.
Oh.
Right? Now, if this stone falls down into the bile duct, okay, it blocks off the bile duct. So what happens when it blocks off the bile duct? The bile goes back into the circulation, and that's when a person starts to become yellow. They start to become jaundice.
Oh.
Yeah, so right, and they start to become jaundice, and when they become jaundice, this gets reabsorbed back into the kidneys and so forth, and the urine becomes dark. And when there's no bile in their gut, their stools will become very pale. Yeah, so these are people we say we have obstructive jaundice, we call them. And if let's just say any fluid that doesn't move in the body, for example, bile, all right, or urine, anything for that matter, doesn't move in the body, gets infected. So this bacteria comes from the gut. Well, it doesn't really crawl up. It's through a process what we call translocation of bacteria. It's from the gut going into the bile duct, and then after that it gets infected. Yeah, that's what are some of the symptoms. Now, some of the even more serious complications is that this stone sometimes causes, it's been postulated if you block the pancreatic duct. So the pancreas also drains at the end of the bile duct, it drains into the bowel, okay? And sometimes it blocks off the pancreatic duct, a patient then can get pancreatitis. This is followed by a severe pain in the upper abdomen, upper tummy, associated with vomiting, fever. And the complications usually are not so much the pancreatitis itself. It's just that problems with pancreatitis and infection in the biliary tract, bile duct tract, and also the gallbladder can lead to severe problems. The reason being is that actually bacteria stimulates the liver to release a lot of chemical in the body, and this chemical will then travel to the rest of your body, for example, your heart, your lungs, your kidneys, and could actually cause these organs to fail. So that's when it becomes severe. So we have a spectrum of problems that gallstones can cause. Everything from very simple, very straightforward, just some pain, to a patient who can be very sick and can be very ill. Most of the time, gallstone problems will occur after heavy meal, after you bake a big fatty food, And right. People who realize that if they watch their certain pattern of their meal, for example, if they don't take a lot of heavy meal, they stop taking milk, they stop taking nasi lemak, their mee goreng, they wouldn't have the pain. But it's worse after they go for kanduri and all this kind of stuff. Mm-hmm. Whereas things like gastritis or gastric typically usually occurs early morning or at night. Mm-hmm. When the acid production is quite high, and or if the person who has very irregular meals, or takes meals after a long period of fasting. So these are the type of differentiation in symptoms in terms of pain.
Can we also get it confused with acid reflux?
Well, acid reflux usually has something to do with gastritis as well. So an overproduction of acid in the stomach, and sometimes an abnormality between the esophagus, the tract from the food path going into your stomach, if there's an abnormality or it's loose around the area, or part of the stomach goes into your chest, like what we call a hiatus hernia, sometimes can cause reflux. But the reflux symptoms are different. They will feel water breath symptoms, which they feel a bit sourish in their mouth after they eat. They will get this burning chest pain some of the times after they eat food, a heavy meal again. So it's a little bit different than gallstone problems. Gallstone problems, they usually feel it lower down, not so much higher up.
I think that's really good to know. Because someone like me, when we just have a pain, we'll just acid reflux, gastric or something, and
all of us, in this age, especially in urban population, we're always under stress, and stress also is a real thing. And recently with the whole COVID thing going on, right, I have a lot of patients coming to me with this kind of symptoms, and the other cause of gastritis is also, of course, H. pylori. It's a type of bacteria. It's a type of microorganism that actually can cause a person to have gastritis and gastric ulcers. And if you're going to eat a lot of outside food, that's going to happen as well. I think for where there's gallstone problems or gastritis, we may brush off this kind of symptoms, but I think what men really need to be aware, anyone for that matter, is that if you have to ask yourself whether the symptom is persistent and whether the symptom actually affects your quality of life and whether you're actually constantly taking medication to overcome the problem and the pain. I think if you have answered these three questions, if it does, you should seek treatment.
Dr. Koong, what can you tell us to prevent gallstones and all these complications?
One of the very good HPP surgeons in Malaysia always say that the cause of gallstones in Malaysia is nasi lemak. Well, diet has part to do with it. I think the fact that our diet is quite rich in fat, but I don't think that's the only factor. Again, I think we fall back to the fact that there's an abnormality in the gallbladder, there's some imbalances in the hormone, there's some abnormality in the bile fluid and so forth. You can't really prevent yourself to getting gallstones, I would say. There are no medications that you can take to actually reduce the risk of you getting gallstones because, to be honest, you don't need to, right? However, I think if you want to prevent complications of gallstones is by detecting that you actually have symptoms early. So if, let's just say, you have pain in the upper abdomen that seems to be persistent, that's not going away, that requires you to take medications that is actually affecting your lifestyle and affecting your work, I think you should see somebody about it. And if they offer things like an investigation, like an ultrasound, and you do see gallstones, if the doctor seems to think those symptoms are due to gallstones, then it's probably advisable to have the gallbladder removed before complications can happen. The other thing is that, of course, if you are so unfortunate, the fact that you can get admitted to the hospital for these complications, for example, cholecystectomy, which is inflammation in the gallbladder, cholangitis, whereby the stone falls down into the bile duct, blocks it off, and you get infection. Or if pancreatitis, inflammation of the pancreas, like I told you about just now. I think once you have these episodes or have these problems, you should have your gallbladder removed as soon as you can. It's very difficult to predict when's the next episode that could happen. Yeah, and the next time that it happens, it could mean a very serious repercussion for you. Yeah, but otherwise, I got a lot of patients who come to me say, they go for the yearly check, right? They see gallstones, right? Because they offer those packages with ultrasound and stuff like that. Then I get these referrals whether they need to remove their gallbladder. So, like I said, unless there's other things like polyps inside, or let's just say the stones are huge, like 2.53 centimeter single stones. If there are no symptoms, I usually say keep your gallbladder and keep your stones. If it doesn't bother you, don't bother the stones.
But I'm sure most people will ask you about what sort of food to take to...
That's a very good question. So this is the type of normal question that I get. I think we shouldn't be too pedantic about the type of food until we do not have any quality of life. I mean, let's look at it this way. Practically, especially people like our age and people who are getting older, is always three things: less salt, less sugar, and less oil. And this is not only advice for gallstones, it's advice for everything. Patients who ask me if they have cancer, what do I do? I say, well, if you want to undergo treatment, you want to go undergo surgery, right? You need to have proper nutrition. So you need to have less oil, less fat, and less sugar. And the same thing if you have gallstones, you have the same thing with diabetes, you have the same thing, you have hypertension. Generally, you just need to have a very good, you have a very good, healthy and nutritional and balanced diet. If you come to a point whereby you need to, I only eat brown rice, no salt, no sugar, all my vegetable have no taste, my chicken is steamed, got no oil, you're going to do that for the rest of your life just so you want to prevent a gallstone. I think that's unnecessary.
Moderation, as they always say. Yeah?
Moderation, that's right. Yeah. Gallstone is quite a common problem, common among female and common among male as well. If you have no symptoms from the gallstones, I think you can just leave it alone. But once symptoms or complications arise from gallstone problems, then the gallbladder needs to come out. The gallbladder surgery is called laparoscopic cholecystectomy. It's actually quite straightforward and quite safe. And there are usually no long-term complications, no significant long-term complications. Usually a person is back to work quite early. There are some rare time whereby during the surgery, there is a risk of injuring the bile duct, but that risk is actually quite small. Significant, but it's actually quite small.
All right, great. I think I've learned a lot about this in just this half an hour that we've spoken. And I'm sure a lot of people also benefit from what you've shared with us. So thank you so much, Dr. Koong, for telling us all about the gallbladder, gallstones, and everything that you shared today.
Thank you, Kevin. Thank you for having me in your show, and I wish you well and Merry Christmas.
Yeah, and Happy New Year. And also, I hope you'll come back on our show. We've got a lot of other topics to discuss about. We hope to see you again on Man Up Malaysia, and we'll talk more about maybe some other topic that you're quite familiar with. All right?
Sure, Kevin. Take care.